The 1980s mark a crucial turning point for the public health in Uganda with the launch of expanded program in immunization targeting 6 vaccine-preventable diseases, and this included polio, measles, tuberculosis, diphtheria. The Minister for Health, Dr. Jane Ruth Acheng, noted that with the advent of the ruling NRM, in the 1986 vaccination against the 6 clear diseases was a priority and a must to all the newborn children.
Our own routine immunization, many of you are aware that government has been in an incremental manner increasing its funding for immunization, not only for counterpart funding, but also for the immunization program. And that is what facilitates us to reach out to the communities together with the heavy funding that is provided from Gavi. But as I indicated earlier on, government has other plans to increase funding, not only for immunization, but for the entire healthcare system through introduction of the National Health Insurance Scheme, but also introduction of a fee-for-service in areas where people cannot provide for themselves insurance.
In the 1990s, Uganda saw a significant progress as the country scaled up immunization services with improved facilities, providing vaccines, reaching out to more children. The production of new vaccines such as those for hepatitis B and Haemophilus influenza type B further enhanced the fight to better the lives and the health of the people. Despite the progress, challenges in access and coverage have remained, particularly for children in hard-to-reach areas, to ensure resilient and equitable immunization.
Although we don't have power in 50%, we have solar-powered refrigerators. So our immunization structure is complete, up to the lowest level. We have vaccines provided. And at the regional level, we have the walk-in refrigerators. So we don't have any stockouts in any communities at any one time. People are able to access vaccines whenever they need it and during campaigns as well.
The Global Alliance for Vaccines and Immunization, Gavi, that started in the early 2000s, has been one of the remarkable undertakings in Uganda's immunization journey. The collaboration went beyond Gavi mere contribution to vaccine supply. The organization supported Uganda in strengthening, training health workers and ensuring that vaccines are administered properly on the beneficiaries. Dr. Sania Nishtar, the CEO of Gavi, visited Uganda in November 2024 and introduced the African Regional Vaccination Accelerator, an initiative to support routine immunization. Gavi set aside $1.2 billion to help Africa access vaccines and protect against future pandemics.
As plants get up to speed and they are ready to produce, we will be providing procurement-related subsidies to make manufacturers competitive, and we hope that the African Vaccine Manufacturing Accelerator, or AVMA as we call it, is going to be a strong signal to the investors to invest on the continent.
With support from Gavi to Uganda, all efforts are channeled on introducing the malaria vaccine into the routine immunization through the strengthening of grants to Uganda. The last decade has been a period of unprecedented success in routine immunization. Uganda was also availed with the young girls vaccine against cervical cancer.
To congratulate the government of Uganda, they will be launching the largest malaria vaccine program in the world, not just in the continent but in the world. That's a huge achievement. They already have the widest portfolio of vaccines on the continent, and the introduction of the malaria vaccine will be the 14th antigen. So I want to congratulate them for that. Currently, as the way things stand, 88% of the cost of vaccines is paid by Gavi, and 12% of the cost of vaccines is borne by the government of Uganda. And this will be the formula for the malaria vaccine as well. And in addition to that, we also provide cash support for health systems strengthening, and this cash support is will primarily be used for the preparation for the introduction, the training of health workers, and any other area which is relevant to the introduction of the malaria vaccine.
Despite challenges as COVID-19 pandemic, which disrupted health services worldwide, Uganda maintains its strong partnership with Gavi.
154 million lives to date have been saved as a result of vaccines. We have been able to halve child mortality because of the use of vaccines. In Uganda itself, infant mortality has been reduced by 68% due to vaccines. And the impact of vaccines, their impact to reduce child deaths, child disease, mortality and morbidity as we technically call it, is completely well documented. And I would urge anti-vaxxers not to spread unfounded messages.
Zahara Abigaba, UBC News.